Hi, I'm Callie Spolsky, and I'm with Thunder Bay Live, and we're here on set with Chirzin Potier, Vice President of Thunder Bay Regional Health Science Center. And I understand you have a few things to tell us today.
Yes, so Kelly, first of all, I want to thank Thunder Bay Live for the opportunity, because I think it's very important to reassure the people of Thunder Bay and Northwestern Ontario about some erroneous information that probably questions, it makes them question the security of their visits to the hospital here. So we had a situation where a story from a year and a half ago has resurfaced with a gentleman that had lost some fingers and was transported in an accident, was transported to Winnipeg for treatment, because the treatment couldn't be performed here at Thunder Bay. So that's a fairly common thing that we do. If we can't perform it here, we send them to somewhere where it can be performed. The problem is when it was reported in a CBC report, and not locally, emphasize it was a national CBC report, they had completely incorrect information about why somebody would be sent from the Thunder Bay Hospital. Even though they were given precisely the correct information and all the statistics associated with what patients we send out of the hospital and why we send them out of the hospital, which I'll get into in a second, they opted in, rather than using that information, to go with the information provided by somebody in Toronto who clearly doesn't know much or anything about the operation in Thunder Bay, and who essentially invented a reason and said it was overcapacity. Everybody knows we have a serious overcapacity issue at the Thunder Bay Hospital. We're almost, gridlock is the new normal. We're almost constantly in gridlock. That's not a secret to anybody, and it's an issue that all the various partners are trying to address. However, it's very important for patients in Thunder Bay and Northwestern Ontario to know that they will never be sent out of Thunder Bay because of overcapacity. That is just flat out wrong. And it annoys me on a couple of levels. One, that they were given the correct information and went with the wrong information.
So let's focus on why the person was sent out of town. So they had an injury, the surgeon wasn't available, somewhere along those lines?
Yeah, so without getting too specific about a specific case, like what I would say is, it's not uncommon. We have probably about over 1,000 patients a year that get sent out of town for treatment. And that would be situations like if you're getting an organ transplant. We don't do organ transplants at Thunder Bay Regional Health Sciences Center. We will never do organ transplants at Thunder Bay Regional Health Sciences Center. So if you need an organ transplant, you're going to be shipped to somewhere where they can actually do it. It's pretty common. 1,000 patients a year or so, not organ transplants, but cardiovascular situations that we don't do here. Things like that, complex pediatric cases. About roughly 800 to 900 of those patients would go to another hospital in Ontario, and about 200 or so would go to a hospital in Winnipeg. And then there would be other like one-offs, like if you're on vacation in a province and you get sick, you go to a hospital in that province. Like, so that's how it works. It's not because of overcapacity, you know.
Okay, so it's not uncommon, and patients need to be aware if they do go out of town that they have to cover their costs for their way home.
Yeah, so this is like, we're kind of stuck in the middle on this one. That was the criticism of Thunder Bay was if a patient ends up out of province and they wake up post-procedure and realize, hey, I don't have any money and I don't know how I'm going to get home, and all of a sudden they're telling me I'm responsible for that. Well, that's a policy established by the Ministry of Health. So Thunder
it's
Bay,
not Thunder Bay's policy.
Thunder Bay Regional Hospital can establish travel policies, but we live with them because we have patients that are affected by them. So, and then if a patient is discharged from a hospital that's not the Thunder Bay Regional Health Sciences Center, we're not responsible for that patient at that point. So we're kind of stuck in this story between Ministry of Health policy and the actions of the hospital in Winnipeg. However, we do try to inform patients always when they're being shipped out to another hospital or transferred what the Ministry of Health policy is about return travel, which is usually that you're responsible for your own arrangements and expenses in returning. you can apply for compensation subsequently. But again, nothing to do with the hospital, it's all to do with the ministry. In the case of somebody where life and limb is threatened,
Right.
and you don't have the opportunity to review the travel arrangements because
Mhm.
it's so urgent and critical, then obviously saving the life or the limb takes precedence over going over the travel arrangements with
Yes.
the patient. So, subsequent to the case that is being talked about now happening, we realized we probably have to ensure in those cases that somehow that information gets communicated with the person.
Right.
Since you can't do it with the person before they leave because maybe they're unconscious or maybe they're groggy and they won't be comprehending, we've developed a travel brochure that we would send with the patient so that at least they have the information upon
Right.
waking or upon completing the procedure at the other place. It's not a perfect solution, but it's, you know, we can control what we can control, and that's what we can do to try to make this situation a little bit better. And so that's what we have done, and we did that in the wake of this incident because we did perceive, you know, there was a legitimate concern about a gap in our information flow, so we had to improve that, and we have as much as we can.
Exactly. So, so when that happens to a patient, you try on your end, what you're saying is to make sure they're informed that they have to cover costs to come home. You're doing everything on your part to ensure the patient has the best care possible. They get to Winnipeg or wherever they're sent.
Yeah.
And they're discharged. That's when they have to take responsibility for themselves.
Yeah, so what we can equip them with is the information about what the circumstances they'll be facing upon their discharge.
Okay. And
So
is
that's what
any
we
of
try
this
to do.
information available on the Thunder Bay Regional site at all about?
I don't know
I
if
don't
it's
know.
available.
I'm not
Many of our publications are available on the website, but we would proactively be giving this to all. I mean, what we're talking about is you know, perhaps 1,000 patients a year, and we would be giving this brochure to all of them as they leave. Yeah.
Awesome. And
when possible, going over it with them verbally. It's just in some
sure.
cases, life and limb cases, that you wouldn't be able to do that.
And with that being said, moving forward, it's taking a more positive approach to what happened to the hospital at this point with the report going out. It's good for you to come out and say exactly what's going on and having a voice. So with that being said, has this person tried to contact the hospital at all with regards with his issues that he had?
Well, I wouldn't be very comfortable speaking about specific cases.
I'm sorry.
I mean, this one's obviously fairly well into the public domain
Yes, it
now,
is.
so I can talk about the fact that there was a guy in Winnipeg and all that stuff, but in terms of follow-up and that. But again, I would emphasize that in this situation, Thunder Bay is kind of a middleman, you know, like we have the ministry over here, we have the hospital in Winnipeg over here.
Yeah.
You know, you know, I mean, obviously, I think there have been communications, but I wouldn't want to get into the specifics on that. Yeah.
Okay. Is there anything else you need to?
I just want to emphasize that people in the Northwest region feel secure that they will never, ever be shipped to another hospital because of overcapacity. We don't operate that way. We deal with our overcapacity as a challenge, but we deal with it. If we were shipping out people because of overcapacity, we wouldn't have overcapacity. That seems fairly elementary to me.
Everybody works hard there. And
Oh,
it's
yeah.
Very evident. Very evident.
Yeah, happy to emphasize that.
Yes.
Yeah.
Well, I'd like to thank you so much for coming on
Yeah.
Thunder Bay Live
No,
today.
again, I really appreciate the opportunity. I think it's important to straighten out that
Thank you
record.
so much.
Okay, cool. Thanks.
Thank you.